Good morning, everyone. My name is Martin Gould, and along with my partners Michael Greco and Symone Shinton, we represent over 100 former patients of youth residential treatment centers in Illinois owned by Universal Health Services who were sexually abused here in Illinois while they were residing at those facilities. My partner's name is Mike Greco, M-I-K-E-G-R-I-E-C-O, and Symone Shinton, S-Y-M-O-N-E-S-H-I-N-T-O-N. My name is Martin Gould, M-A-R-T-I-N-G-O-U-L-D. As I said, yesterday we filed a lawsuit against Universal Health Services and Hartgrove Hospital in regards to one of dozens of former patients who were sexually abused there as children. We represent over 100 former patients of UHS facilities in Illinois who have been sexually abused as children while residing there and undergoing treatment there. The victims range from ages 8 to 17 years of age, spanning the early 1990s until 2022. Now, the nature of the abuse is beyond the pale. It involves child rape, oral sex, forcing children to perform horrific sexual acts on one another for the entertainment or sexual gratification of staff members. That includes sodomy. Staff regularly use and force children to take unprescribed medications such as benzodiazepines and Thorazine to sedate patients. In many circumstances, patients were sexually abused after taking these medications, after becoming sedated. There were instances where staff walked in and witnessed the sexual abuse of children, laughed, closed the door, and never followed up again after that. This case involves physical violence and intimidation, putting children into seclusion rooms for punishment, and at times for sexual abuse. Where did it occur? Many of these victims were abused at night while they slept. They could hear footsteps approaching at times, and they knew it was coming, and they could do nothing about it. It happened in the showers, where staff stalked their prey, told them to bend over and show them things. It happened in the bedrooms, happened in the seclusion rooms. It happened during alleged therapy sessions. Children were told that this was part of therapy. They were coerced. Some children were given extra benefits or favors while they were there. They were told this is part of therapy, this is the only way to get better. That they'd go home sooner if they participated and engaged in these acts. When children didn't comply, they were retaliated against, they were punished, they were physically beaten. Staff members exploited the vulnerability of these children. They had medical records, they had access to information that gave them the ability to prey on them. They knew that many of these children just wanted to get home, and they told them they were never going to leave the facility. They weren't going to get access to phone calls with their loved ones if they didn't comply, if they didn't submit. And so children submitted for survival. Now you're going to hear later today from one of those survivors, a brave former patient who was sexually abused at Hartgrove Hospital in around 2001. He's just one of many, one of dozens. His trauma will reveal to you what feels like a horror movie. He was around 11, 12 years old when he stayed at Hartgrove for the first time. He was sexually abused by 3 different adult staff members. They forced him to perform horrific acts on them. They encouraged and directed and instructed older patients to sexually abuse him in their presence for their own gratification and entertainment. He remembers their faces. He remembers some names. He remembers what it feels like when he was told he was going to have to go back to that facility. He tried to run away. He was too ashamed, too embarrassed to tell his mother and his grandmother what happened. And he was sent back to that, what I'll call a hellhole. Some survivors did report abuse. Some even reported it to law enforcement. They weren't believed. They were discredited. They were told that they were suicidal. And notwithstanding hundreds of reports of sexual abuse and state and federal investigations into misconduct, UHS still defends its practices at these facilities. Now, in 2010, the situation got so bad at Hartgrove Hospital that DCFS asked the University of Illinois at Chicago's Department of Psychiatry to launch an investigation. Their investigation was extensive. It included a review of 12,000 pages of records and reports and 6 months of interviewing and monitoring patients. UIC's findings were disturbing. A summary of some of those findings can be seen here about the utter failures of the institution to protect patients, to ensure a safe treatment environment, ensure adequate staffing, failure to adequately train and supervise staff, critical failure of accountability by UHS. Some staff described this as a place that had violence every single day. UIC concluded it was a dysfunctional institution. On page 133 of their extensive report, one of their conclusions was one of the most concerning. Regrettably, since the performance record of UHS Hartgrove officials seems to include deceptive practices, intimidation of any staff who might wish to provide information to the UIC reviewers, and misrepresentation of facts regarding the care of DCFS wards, the department can have little basis for confidence in continuing a working relationship with this hospital at the present time. Despite the horrific things that were going on, for financial considerations and otherwise, there was an active cover-up. Cover-up involving horrific abuse involving the most vulnerable people in our community. And with that, I'm going to hand the mic over to my partner, Michael Grieco, who's going to talk to you a little bit more about UHS and the big picture of what was going on with that company.
Thanks, Marty. Good morning, folks. A little background about UHS. Neglecting and exploiting patients is the business model of UHS, and quite frankly, business has never been better for them. UHS is the largest operator of freestanding psychiatric inpatient facilities in the United States. UHS is valued at roughly $11.8 billion today. And just last year, the UHS CEO received $14.5 million in compensation. Over about 40 years or 4 decades, UHS has sustainably grown into a multi-billion-dollar Fortune 500 company through strategically acquiring youth residential treatment facilities like Hartgrove and infusing them with the UHS way of doing things. What's the UHS way? Understaff, undertrain, the things that they were cited for, and bill Medicaid for treatment not actually provided to patients. For decades, state and federal governments have investigated UHS for these practices, resulting in multi-million-dollar settlements paid by UHS. While sexual predators are exploiting children in their bedrooms, staff members are writing medical records stating that the patient is with a therapist. Utter fraud. In 2022, Illinois Department of Child and Family Services paid nearly $110 million to licensed residential facilities certified to provide Medicaid services, MCIs. UHS owns and operates over 330 of these facilities in 39 different states throughout the United States. At least 13 of them have been shut down due to public allegations of physical and sexual abuse of minors. Behavioral health facilities like Hartgrove are UHS's primary profit centers, accounting for 43% of UHS's total net revenue, 43% or $6.2 billion last year. And taxpayer-funded Medicaid are a significant portion of those dollars. Medicaid alone constitutes nearly 30% of UHS's total revenue. Taxpayer dollars going straight into the UHS pocket, totaling up over $14 billion. The business of housing these children is, in UHS's words, a highly attractive industry. We are talking about vulnerable children. In an earnings call last year, UHS's CFO stated that increasing occupancy, direct quote, of these facilities is the most significant opportunity that we see for business. And that's the plan for Hartgrove. Continue to do nothing about the systems that are creating and that are tolerating sexual abuse of patients. Just add more beds. Just make more money. My partner Symone will further discuss what the federal government has revealed about UHS in the recent years. Thank you.
The child sexual abuse occurring within UHS's youth residential treatment facilities is a national public health crisis. That language is not hyperbole. John Doe's horror story that you will hear later today is not an exceptional circumstance that can be limited to just one facility in Illinois and a few bad actors. UHS's business model provides a platform for sexual predators to prey on vulnerable children nationwide. And you don't have to take our word for it. The federal government has said as much. 2 years ago, the federal government issued the report next to me, Warehouses of Neglect. The findings are disturbing, and we could spend the entire press conference talking about them, but I will quote just a few. The risk of harm to children in residential treatment facilities, or RTFs, is, quote, endemic to the operating model. The harms children in RTFs experience are the direct and causal result of an operating model that incentivizes providers to optimize revenues. Horrific instances of sexual abuse persist unremedied inside RTFs. Some UHS facilities offer both sex offender treatment and sexual trauma treatment in the very same facility, in the same location. Copious evidence from both the committee's review and public reporting support the heartbreaking reality of, quote, pervasive sexual abuse by staff members in RTFs. The Senate committee found that these facilities are routinely and endemically understaffed. Their employees are poorly trained. Background checks, including the most fundamental of state abuse registry checks and licensure checks, are not completed properly, if they're completed at all. The Senate committee found one UHS facility, when it was audited, could not produce any evidence that it actually performed a state abuse registry check for half of its employees. When UHS officials were asked questions by the Senate committee to reflect their internal policies, many of their answers directly violated state or federal law. For example, to the question posed to UHS leadership of whether an employee's failure to report known child abuse would result in disciplinary action, their official answer was that it might. When the committee posed the question of whether there are any circumstances where it might be appropriate to both chemically restrain and seclude a child, in other words, injecting them with the sorts of drugs that my partner Martin Gould mentioned, and then putting them alone in an isolated room, is that permissible? I'll cut to the chase. It's directly prohibited by federal law. But UHS personnel stated that they believed that it could be necessary to do both in certain circumstances. We must ask ourselves what it says about a healthcare institution that relies on our taxpayer dollars for its profits, that our federal government had to spend taxpayer dollars investigating whether our nation's children are even safe there. But this is not the first time UHS has been on the federal government's radar. As early as 2008, the Department of Justice began its first investigation into a UHS youth residential treatment facility here in Illinois. Now, that investigation would go on to balloon into a decades-long nationwide review into UHS and its facilities across the United States for claims that they were billing Medicaid for medically unnecessary treatment or treatment that was not actually being provided to patients. UHS would ultimately pay the DOJ $122 million to settle those allegations, as well as dispersing about $30 million to states for the same claims. A few stories from the DOJ's investigation. The first known instance of UHS employees being criminally prosecuted for sexually abusing UHS patients begins in 2001, when 2 employees raped a minor. In 2012, one UHS facility in Florida was shut down when 2 employees were discovered to be abusing patients. The first employee was the supervisor of the entire facility. That person was convicted with felony child abuse. The other was a mental health technician who was found guilty of sexually abusing 6 minor patients who were coming to that mental health technician for care. In 2013, at another UHS facility, a male nurse pled guilty to sexually abusing a minor patient. In February of 2017, the CEO of a UHS facility located in Oklahoma City openly told investigators that they don't report instances of sexual abuse from that facility. They handle it internally in their own investigative process. Concerning admissions from UHS executives of conduct that clearly violate state or federal law can be found across its national satellite of facilities and in both the 2022 Federal Senate Committee report and the 2010 UIC report. Simply put, UHS cannot credibly tell the public that they do not have or do not know that they have a child sexual abuse problem on their premises. This lawsuit is the first of many that will expose UHS's business model of exploiting children as we continue to empower survivors like John Doe to tell their stories. Just this year, a jury in Illinois awarded a patient $535 million for the sexual abuse that they endured at another UHS facility here in Illinois, based on UHS's negligent practices and institutional failures to protect them from this abuse. We are at the tip of the iceberg in uncovering the full extent of what UHS knew, knows, and should have been doing to prevent this widespread child sexual abuse from the very patients from whom they extract profits. My partner, Marty Gould, will discuss what we must do as a society to help bring an end to this public health crisis. Thank you.
So where do we go from here? What can be done? Well, for starters, when it comes to child sex offenders, they should be given no quarter in the state of Illinois or nationally. That means when it comes to criminal prosecutions, we're of the position that there should be no statute of limitations, not just prospectively, but going back decades. There's a huge movement across the country in recognition of the need to change laws to make them more fair and to make the community safer. They've changed statute of limitations in many other states, created revival windows. The same should be done here. There has to be more active enforcement of mandatory reporting laws. In our case, there was a staff member who walked in, witnessed child sexual abuse, laughed, closed the door, and never followed up. He should be in prison. There has to be stricter enforcement of institutions that violate regulations that pertains to youth residential treatment centers and foster care. Recently, just yesterday, there was a bill that passed in the Senate, the United States Senate, called the Stop Institutional Child Abuse Act. It's a bipartisan bill sponsored by Jeff Merkley. That bill needs to pass the House. It needs to be signed by the President. It needs to take effect as soon as possible. Through this lawsuit, we're going to uncover every stone. We're going to identify the names of every single perpetrator. Right now we have many descriptions. We have first names. We have other things that can help us identify them. Through discovery, we're going to get employee lists. We're going to work with law enforcement as much as we can, and we're going to find out exactly who these people are, and we're going to pursue claims against them any way we can. These people, we believe, are still out there in the public. We still believe that they may, at least some of them, have access to children. It's a safety hazard. It's a public safety issue. In a lot of these cases, there's a thought, well, some of this abuse happened many years ago. Things have changed since then. Here are Chicago Police Department incident reports involving allegations of child abuse since 2007 to present. In just the past 3 years, there's been dozens of reports involving abuse at Hartgrove and other UHS facilities in Illinois. Something has to be done. Something has to be done now. This is a pressing problem. We're going to push for legislation. We're going to uncover who these perpetrators are and expose them. And we're also going to seek justice for the survivors. And with that, my partners and I are going to bring in one of those survivors who's going to talk a little bit about his experience, the trauma he endured, and what he hopes for the future. If you guys can please direct your cameras from the chest down and give us a few minutes. Thank you. John, can you tell us a little bit about how you ended up at Hartgrove, what your experiences were like there?
Well, I ended up there because my mother felt that I needed to get some help for my behaviors. I was young, and growing up, it was rough. Being a preteen and having emotions and just not knowing how to handle them. She wanted me to find a good coping mechanism, a healthy coping mechanism, a healthy way of dealing with them instead of throwing things or having tantrums. So she took me to Hartgrove. She said they will help you control any emotions, any anxiety, any anger that you may have. And they're here to help you, and they're supposed to help you get better and figure out healthy ways of doing things. After I got there, they told us that we would be doing group sessions and individual sessions, and they're going to be talking to us on how to develop healthy ways of expressing ourselves, healthy ways of coping with certain things that we are upset about, or just everyday life. After being there for about 2 days, I was in the bathroom getting dressed. And one of the employees that walked in while I was drying off, and he told me, go ahead and finish, hurry up so we can go down and have a session before it's time for lights out. At that time, I was drying off with a towel, and he said, well, turn around. He wanted to see my backside, and he said, well, spread your cheeks. I want to make sure that you're clean. He said, I got to make sure that you guys are not dirty going to bed. I said, okay. So I turned around and I spread my butt cheeks for him, like he asked me to. He snickered. And I said, okay, we'll get dressed. Let's go. So we got dressed. We had our last group session, and it was lights out, so it was time for bed. We had hospital pajama pants on and nightgowns. And my bed was closest to the door. So I laid there and I was looking out the door, and the lights were on in the hallway. And he walked by and he said, hey, it said it's lights out. Go to sleep. I said, okay. He said, remember, we're here to help you, and we're supposed to help you get better, so you got to get your sleep. I said, turn around and look the other way, away from the light. So I did. A few minutes later, I heard him walking back. I didn't know if he was doing his rounds or whatever, but I heard him walking in the room. And he walked over to me as I was in bed, and I heard a rattling of plastic. It was one of the utensil packets that they would always give to us. He then reached under the blanket and he started to grope me on my butt. And I heard him unzip his pants. And he started masturbating. And then he stuck his finger in my butt and was groping it as he was masturbating the whole time. Once he was finished, he came inside of the napkin and he pulled my pants back up some and leaned down to me and said, you're supposed to listen to us. Your actions have consequences. Next time when I tell you to go to sleep, it's lights out, it's lights out. And he left my room after that. It was almost an every other day occurrence while I was there. If they took more than one of us, then they said that they were going to go have a group session. They would force us to do things to each other. Whether it was performing oral sex or them making us perform oral sex on them or each other. Watching us do things and masturbating, telling us that we have to listen or we're not going to go home. We're not going to be able to see our family. And we can't say anything about it because it's our therapy. This is what we were there for, to get better, and they were doing their job. It didn't feel like it was therapy. It felt like we were being punished for being there. And they said, if you listen to us and you do exactly what we say, then you won't have to come back. And if we tell anyone, then they're going to make sure that we don't get out of there. it was hard waking up every day not knowing whether I was going to leave that place or whether I was going to have a group session or an individual session with one of them. Sometimes when they would give us our meds, there was always an extra pill in there on the weekends, I feel. The medicine would make us drowsy. And sometimes I would wake up with 2 people masturbating over me and wake up sore.
2 adults without members?
Yes.
How many adult staff members were the primary perpetrators?
3 of them. 2 of them, a lot more than the third. The third was more like someone that would join in if they almost forced them or said, well, we've done it before, you can do it again.
Was there ever any instances where a staff member walked in?
Yes. And they walked in and they laughed. Like it was a joke or a game. And they would walk back out.
Thank you for sharing the experience with us, and I know it's probably not easy for you to walk through this again. Here we are several years later. How have those experiences impacted you as you are now trying to go about your day-to-day adult life?
They've impacted me on multiple statures. It's hard for me to look at a therapist and think that, you know, you're here to help me. You know, I will never go in person to a therapist because I don't know what the therapy would be or if that what I went through at Hartgrove was considered extreme therapy. It has hindered me from sleeping at night sometimes, having flashbacks, trying to find coping mechanisms to forget or block out things that have happened to me. It makes it very difficult to trust the healthcare system to do its due diligence when that's what was being done to me the entire time. It's
How long were you there?
For about 2 to 3 months. Around 10 to 13 years old back then.
What made you want to come forward?
I myself have a child, and my kid is displaying behaviors, and she's just not having the best of a time. And her mother suggested that we do therapy, and it was a trigger for me. I don't want my kid to go through that. I don't want anyone's kid to go through that. I don't want to send my kid to a camp because it's scary. knowing what happened to me, I don't want that to happen to my child. And I really can't trust someone to help me with her behaviors if that's the mindset I have of how I was helped with my behaviors.
Did you ever tell your mom what happened?
No.
As we're hearing that some of the reports were reported to police, did you ever talk to police or anyone outside of Hartgrove about what happened to you during that time?
No, they told us not to say anything to our parents about it or anyone. They said that it was a part of our treatment, it was a part of our therapy. They were there to help us get better, and we can't say anything. And if we did, then we would be there longer. So I was too scared to say anything because I didn't want to go back and I didn't want to be there longer.
What are you hoping happens with this lawsuit? What is the outcome that you're looking for all this?
For this never to happen to anyone else again, for policies to be changed to actually help people develop good behaviors and coping mechanisms with things, for it to change and not be the same humiliating factor in someone's life.
Really appreciate it. Thank you.
So, I mean, obviously listening to his story is just absolutely horrific. Why, you said you're representing over 100 victims, is that correct?
Across,
Across the country?
no, across UHS facilities in Illinois and over 40 at Hartgrove Hospital specifically.
Why, what prompted you to file the lawsuit now? Was it just the sheer number? I mean, why were you waiting, I guess? That's the question.
Well, this is just the first of what's going to be many. And, you know, unfortunately, most survivors of child sexual abuse never come forward. That's the statistics. And when they do, they usually come forward in their late 40s and early 50s. So, you know, John Doe 1 is a tremendous person. The courage that he's demonstrated coming forward much earlier than that. And, you know, it's not easy for people to come forward and tell those types of stories. You know, through our investigation, we realized that, you know, this isn't a one-off, a two-off. This was systemic. The nature of abuse is, I mean, it's horrific. It was systemic. We believe there's many, many others out there. You can hear just from his story, there was others involved in that abuse that were also abused that he saw. Okay, we don't represent all those people, but we represent many others who've had similar stories, and just the scale of it is just unprecedented.
If I may ask you, the 2010 DCFS study that prompted them to stop working with Hartgrove, have they restarted working with Hartgrove or no?
Well, my understanding is that DCFS does work with UHS facilities in Illinois, and my understanding is that they still also work with Hartgrove in some capacity since then. They certainly do work with UHS in Illinois.
I believe it was Mike that said that 13 UHS facilities have shut down as a result of allegations against minors. How can we pinpoint specifically that that's why they were shut down?
There have been some there's been investigations into a number of those facilities. So for instance, our law firm, our team represents many, many former patients of Rock River Academy, which was closed down in 2015. That was in Rockford, Illinois. And back in 2015, there was a Tribune investigation spanning many, many months, which revealed some horrific abuse there. You know, that was a microcosm of what now we're seeing at many other facilities in Illinois and really across the country. So, you know, they've been coming up on a sporadic basis. Now, for the first time, we're seeing the scale of it, that it was countrywide and statewide, not just Rock River, many facilities.
Do you have the list of those 13 facilities that have been shut down as a result of these allegations?
We can certainly provide a list. The U.S. Senate, you know, cites to a lot of them in their 2022 report.
They're the Senate.
Yeah, a lot of them will be cited there, and we certainly have a list that can be provided. I can't roll off all of them right now, but it's staggering.
And obviously, a lot of what you're looking for is just, you know, won't come out until discovery, right? In terms of trying to identify the employees and everything else.
That's part of the process. So, you know, because we represent so many people, it actually serves as a huge benefit to other survivors we represent, because we're seeing a lot of the same names come up, and that tells us that there's serial predators that were there. I mean, these people were apex predators, preying on the most vulnerable kids, using information from their medical records. They couldn't go anywhere. They couldn't leave that place, you know, without really a nod from that facility. You know, kids were being designated as suicidal on an increasing rate after UHS took over Hartgrove, in part because we think billing reasons, and they could bill at a higher rate, but also kids can't leave that place if they're designated as suicidal.
Anything you'd like to add, Mark?
Just that, you know, because now we're realizing this was just systemic abuse and just the sheer scale of this, it really is a public safety issue. I mean, we believe that there's many of these perpetrators still out there. You know, God forbid they're still in positions of power and authority over children. So we want to move as quickly as possible with this case, and that's, you know, child safety is the number one. Justice for the survivors is the other important part, but there could be pressing safety issues. You know, I'd like to also add that we are looking for other witnesses, other survivors to come forward. You know, there is strength in numbers. As you heard earlier, you know, staff would sometimes dare these people, go tell on us, because who's going to believe, you know, this kid who's got behavioral issues or was designated suicidal versus a staff member? But you know what? Where there's smoke, there's fire. When you have a lot of people coming forward that didn't even know each other during different points in time, identifying the same perpetrators, it's compelling. You will be believed. And if you're a former staff member who left, who quit, if you have information, you know, now is the time to step forward, do the right thing, and help these victims, you know, get some sense of closure, and let's put some of these perpetrators, you know, away if we can, or at the very least identify them and expose them so they can't be around kids.